So at the core of everything that we do here in Cardiff Pain and Performance is our 5-step process. Our 5-step process is a way that we're able to chart your progress through to recovery and are able to identify the different stages that are required for healing. So the first step is when you come into the clinic, we need to provide you with an accurate diagnosis. Now, we do that through a range of tests that we run here in the clinic, from gait analysis to checking eye movement, to checking orthopedic tests to see if there's any evidence of arthritis, to actually seeing what the muscle stability around the joint is. And the reason why we do that is that if we find that there's a structural problem like a broken bone, perhaps a prolapsed disc, or some hardware structural problem, then it may be the case that we need to refer you out for further x-rays or MRI scan in order to find out actually if it's the right time for you to be in the clinic and we're able to help you. So at the start of everything we do with our 5-step process, we need to accurately diagnose the problem. Step 2, if we have accurately diagnosed the problem and we feel that we definitely can help, the most important thing is actually to get control of your inflammation. Generally speaking, when we injure a body area, the nervous system and the endocrine system and your immune system produces inflammation. And we can think about inflammation as the text message produced in the tissue structure that sends a message up to the brain to say that we've got a problem. And by and large, it's the inflammation in the area that is actually the cause of the pain. It's the text message that your brain is receiving saying there's a problem, and therefore the brain will give you pain. And so step 2, most importantly, we need to find an effective way at an early stage to manage your pain and manage the inflammation. Step 3, and this is where the majority of the work is done in the clinic, is that often the problem with the joint that's causing you pain is a lack of stability. The brain is unable to control the joint in an effective way, therefore causing irritation and inflammation. So we need to, in a sense, desensitize your brain to the information coming from the site of the injury. So step 3, we need to desensitize your body to and your brain to the injured area. Step 4, and this is where we really start to encourage our patients that it's okay to get moving again. And in this sense, we need to start loading up the area that was previously injured, because the brain will have started to become fearful that any loading into that area might actually cause further trauma. And so we really need to start to desensitize and load the area that was previously injured to invite the body to move freely again. And then the last stage, step 5, is we really need to now strengthen up that body part. We strengthen up that body part to provide more resilience in order that we can be sure that the problem won't come back in the future. So how do we put all of that together from stage 1, diagnosis, all the way to stage 5, where we're giving you increasingly complicated strength training just to bulletproof you to ensure that it doesn't come back? Well, it really starts, as we've talked about before, with the diagnosis and thorough examination in order to make sure that you're in the right place and we don't think that there's a structural problem that would mean that you need to get an X-ray or an MRI scan. So one of the things that we like to do is, if you came in with a bad shoulder, we want to assess the movement in the shoulder. And we talk about assessing the movement in a passive range and in an active range. So we get the patient to move the shoulder themselves, and we would indeed move it ourselves. We'll also check for the correct reflexes, the correct response, the correct feeling, and gather all that information together with the clinical history. And it may be the case that we conclude actually the range of motion is really pretty good. It's quite painful, but actually it's really good. So we might conclude from that we don't think that there's actually a bony or structural problem as such. Even if you've come in perhaps with a diagnosis of a bursitis or a supraspinatus tendinitis, we know that biomechanically that's actually a functional problem and it's not necessarily a structural problem. So we would be happy in that case to go ahead and treat you in the clinic. And so therefore we would put you into stage 2. Now stage 2 is really all about trying to reduce the inflammation. Now of course inflammation happens as a result of a certain degree of tissue damage, and very often with biomechanical problems the tissue damage actually is caused by overuse or repetitive strain on certain tissue structures. Very often that will be the rotator cuff in the shoulder, and it may even cause something called a bursitis, which we can think of like a little airbag that inflates to try to protect the structures. In that case, what we need to do is actually control that inflammation first. And the reason why we need to control that inflammation is because we know if we control the inflammation, number one, you'll actually feel a lot less pain, because the inflammation contains the text message, the neurotransmitted information up to the brain that tells the brain that there's a problem. And if we can reduce the inflammation, you're going to get much less pain. So that's obviously a good thing and a good place to start, because it'll give you confidence in moving the shoulder a lot more. And then the second reason why we need to reduce the inflammation is because when we go into stage 3, we really need to ensure that we start to desensitize the tissue structures in order that you can eventually move the arm correctly. And what we found in clinic is that if we don't adequately reduce the inflammation, we may find a muscle here that's very weak, very weak. And when we rub here, suddenly it becomes super strong. And so we think, great, the inflammation that's causing the reflex to go weak is located here. But the problem with that is if this area is very inflamed, even if we try to desensitize this inflammation now, unfortunately the problem is likely to come back due to the inflammation. So in which case we need to deploy our laser in order to try to reduce the inflammation in this area, in order that when we move you on to stage 3, when we try to desensitize the treatment, desensitize the structure there, you remain strong. And the way that we can catalogue your trajectory that you really are improving is that when we bring you into clinic and we switch on some of the muscles here and get you connected to them again, when we bring you in for your follow-up on the next treatment, the first thing we do is actually to assess all of the things that we've got you connected to last time has stuck, meaning you've started off the place that you finished off in the last session. Of course, if that doesn't happen, then there may be a little bit more work to do to reduce the inflammation in that area. But the goal at all times in clinic is to see improvement. Firstly, a reduction in pain, hopefully, and then an increase in ability for you to connect to different areas of your body. Now with the shoulder, you have 14 muscles that have governance over the shoulder. So lots and lots of different muscles. And by the end of stage 3, we certainly want to see that every single muscle you're connected with that can be strong. And actually when we show you parallel lines, it can also relax. So we know that the shoulder is operating normally. And so at that point, we move you on to stage 4. Now, stage 4 is all about trying to really encourage you to access movement again. So we're going to give you a whole bunch of different varied exercises in order for you to challenge the joint in every single position it's possible to go in. So one exercise we might give you for the shoulder would be something like an arm spiral. So an arm spiral would be looking at alternating, supinating and pronating the other shoulder in order that you're actually exploring that full movement. And what we want to see is that when we bring you back in for a follow-up, having done all of these exercises, that you maintain strength and connectivity in all of these positions. Because if you can do that, that tells me we've actually asked a harder question of your nervous system. Rather than, are you just strong, can you move in lots of complicated and varied and adaptive ways, and your nervous system is still, I feel no threat there. And once we've concluded by testing all the muscles, you're nice and strong, we move you on to the final stage. And the final stage is all about resilience. It's all about bulletproofing you for the future. So that means strength training, and we progressively encourage you to do stronger and stronger exercises in order to ensure that the shoulder is confident in all positions to be strong, and actually to ensure that the problem doesn't return for you.